Dr. Nancy Johnson. She is the program manager for the Kentucky Wastewater Surveillance System. She is a doctorate in public health, is a certified industrial hygienist, and has spent her career in occupational and environmental health with a focus on exposure measurement. Currently, Dr. Johnson is the OEH Countermeasures Manager for the Kentucky Department for Public Health, Division of Public Health Protection and Safety. Thank you, Dr. Johnson, and you can take it from there.
All right, so I'll begin. If you have questions, and you can put them in the chat, and I'll trust Kristen or Melissa or Julia to pick them up and bring them to our attention. The Kentucky Wastewater Surveillance System is a relatively new program that's come up, and so we thought we'd share it with you because it's very helpful for the respiratory diseases season coming up. So I'm from the Department of Public Health. We're a major part of the cabinet for Health and Family Services, and this program that I'm going to be speaking about, the Kentucky Wastewater Surveillance System, is housed in Public Health Protection and Safety, but we partner quite tightly with epidemiology and health planning, and then we also use our laboratory services handles about a third of our sites. So what we're going to do is kind of review the process, how we get these samples, and then how we use the data, how it's displayed on the dashboards. We're going to talk about what sentinel surveillance is and how it's based in our 5 preparedness regions across Kentucky. Talk about the weekly respiratory virus sampling that we do and how it supports respiratory disease surveillance. And then what our plans are for how we will use it, be able to use it in the future. We'll talk about the dashboard data that the National Wastewater Surveillance System has. That's also known as NEWS. And so we are the Kentucky Wastewater Surveillance System, and we go by QWS. So we have both a public website and an internal public dashboard and an internal dashboard. And then there's a third one that might be of interest to you all that's sponsored by Wastewater Scan. And Wastewater Scan is actually an academic research project. It's between Emory and Stanford, and they are using wastewater data from Morris Foreman, which is in the Metropolitan Sewage District of Louisville. It's the largest one in the Commonwealth, and they do a lot of different tests there. We'll talk about the University of Louisville and how they use it in their work, and then we'll kind of how you can use it. So what can QWS do for you? They can tell you when the next outbreak or the next rise in cases could be on its way. It could tell you how bad it might be. It helps us accommodate for freedom of movement and travel, and not restrain or put people into quarantine. How can we watch for actual cues, which that goes with our name, without interfering with privacy? And could we do something early on in an outbreak to minimize the impact in communities? So the Kentucky Wastewater Surveillance System, it's a very novel idea. It's actually been around for quite a while, but received more wide application during COVID because of the pushback as far as contact tracing and everything else. So what we do is we take a sample from the combined discharges. So everybody's toilet in a sewer shed empties into a treatment plant, and you may know where yours is in your community. So before it goes into the whole process, we take a sample and then use PCR to analyze it for various viruses. There's other things that can be looked at too, but in Kentucky, we're looking at 4 respiratory viruses: COVID, flu A and B, and RSV. We do twice weekly collection from regionally prominent communities and then analyze using digital PCR for those viruses. We report them on both a public and an early internal dashboard, and the results are up weekly, and it's pretty quick from collection to results. They're 24-hour composite samples, and I'll show you that in the next slide. We send FedEx to pick it up. We have memorandums of agreement with all these sites, and we provide them with an annual retention payment that works out to about $20 a sample because they are making an extra effort to pull this for us. We do this in partnership with local public health, and we think that it is a small investment, but it has huge returns. So this is what a wastewater treatment plant looks like. This actually is West Hickman, which it's funny. In Kentucky, we have several of these situations, but Lexington has two wastewater treatment plants. One is Town Branch, and that's for the northern part of Lexington. And then the southern part going into the whole Brandon Road development is served by West Hickman. And so it's actually in Jessamine County, but it's carrying quite a bit of Lexington's burden as well. Typically, they're right near a water source so that the cleaned water can be returned back in. So this is what an auto sampler looks like. This is what they have at Bowling Green. It's very small. It takes an aliquot every hour for 24 hours, and then takes a composite out of all of that, and that's how we get our sample. And that's helpful because a grab sample could end up hitting when everybody's flushing first thing in the morning or not. And so if we can get a sample that's representative of the full day, that's preferable. And then this is what a digital PCR looks like, very small desktop type unit. And we have one of these, the QIAGEN, for example, the QIAcuity 8 is in our DLS lab. So the advantage to this type of monitoring and using it as sentinel monitoring, meaning way ahead of the curve, is that it's anonymous. You're just one toilet, one shower, out of thousands. In most cases, it's thousands. Often it's hundreds of thousands, tens of thousands. It's a standardized measure. It's the same 24-hour composite sample at every site. We have quick turnaround and quick access to the data. We've divided the way that we do this in Kentucky by our 5 emergency preparedness coordination county groups. And I'll show you a map of that on our dashboard later. We have 7 to 8 sites per region, and what we're looking for are centers of activity. So we began, when the project began, they were very concerned with sites that were COVID vulnerable, and typically those were much smaller communities that just didn't have resources or were at distance. But as we began collecting the data, we realized that for most local health departments, regardless of where you are, you want to know, if you live around Bowling Green and everybody in your community goes into work in Bowling Green, you'd really want to know what's going on there, as opposed to maybe even knowing specifically what's going in your town. You might know that, but to know what's upcoming, it's better to be able to look at, a center of activity. So our goals are to help you prepare early, to develop more accurate risk communication, to help with decision making, and help us all work together. If you know that the symptoms being reported to you are more likely the flu than they are COVID, it helps you act in a way that's most appropriate. So we want to focus on these centers of activity, and they're, each sewer shed, it's the catchment area. It's where everything empties into. And so it helps us identify whether this is a strategic location that's going to be really helpful for us in preparedness and epidemiology. So we look at things like how many people are there, how many jobs are in the region, how many hospitals, universities? Is this where we have mass gatherings? So, you think we've got Derby, of course we need all of Louisville. So, and then we also are looking at, what kind of of activities also are going on in the region. So if we know that there's a site that is really representative of a lot of poultry farms, then it would be really good to have them within our network so that if we have an outbreak that's kind of associated with that, we can flag them right away, or we can look at that right away. And we use the Kentucky Infrastructure Authority actually has some great maps that show traffic counts and traffic flow. So we try to get communities, and we're still building the system, but we try to get communities where everybody comes into and goes from, so that we know a place that is influential in its region for perhaps disease spread. And so by characterizing these, we can target new sites and, improve the way that we do our inputs. So we have a decentralized public health system. And what that means is that each local health department has jurisdiction where it is. And we do a lot of support for them, but we can't even if there's an outbreak, we have to work with the local health department to manage the situation. So we're trying to develop this network of sentinel sites across the Commonwealth, first of all, to compare each to each other, and then to use it for all LHDs, because that's where their people may be driving to. So I did a presentation on this way over on the west side of the state, and way past, and it was past, I'm from Lexington, way past Louisville. And it was the Board of Health, and they said, this is fantastic, because my gosh, everybody goes to the UK games. And I thought, that's a heck of a drive. But, to know what's going on in Lexington is always really helpful wherever you are. If are a Cats fan, and if you're a Cardinal, there's that too. And just knowing what's going on it can be really helpful. It helps us help local health departments and district health departments manage outbreaks. And we're working with respiratory disease surveillance, and we're currently in the process of working to really integrate our two dashboards. Syndromic surveillance covers things like clinic visits, emergency rooms, and hospitalizations. But if you think about it, if you were, of all the people probably this month, who have had COVID, because we had a little bump up in that, how many of them went to the doctor, and how many just sat home on the couch and watched Netflix? We catch everybody that uses a toilet, whether it's at the doctor's office, whether it's at it's at home. So we think that we get a bigger pool of collection. So right now, what we're doing is respiratory diseases. If a community decides there's extra things, there are many other items that can be addressed. So right now, these are the sites that we have data for that are reporting on our dashboard. So Murray in Callaway County, Shelbyville, Bowling Green, Madison, not Madison, Richmond, Somerset, Princeton, which has been with us since our pilot days. They are a little smaller, but they are right off of, I believe it's 69, and they are in Western Kentucky, where we need to develop the field a little bit more. And then we have one from Northern Kentucky at the Dry Creek SD1 wastewater treatment plant. And these are all served by our lab. Now we have academic partners. So we picked up, University of Louisville is one of our partners, and they manage these sites for us and bring this data to us to report. So Morris Foreman is the largest sewer shed, the largest wastewater treatment plant for the whole Commonwealth. And they've always been in the network. Within the last year, we've added in the other 4 wastewater treatment plants, because it was always interesting to know what was going on in Morris Foreman, but that's pretty much downtown. So there's a lot of travel, a lot of big events, everything. And knowing what's really happening when people go home at night is what we see if we have the other 4. And then our next partner is University of Kentucky. And we really needed to have Lexington in our surveillance system. And Lexington loves UK. So UK became our partner and brought along Ashland in Boyd County, Grayson, and Grayson's kind of on, it's on 69, yes, 69. Wait, no, it's on, anyway, then they have Pippa Passes. Pippa Passes is our tiniest location. They also have Alice Lloyd there. So we're kind of going up right now. Pikeville, Prestonsburg, both of the Lexington ones. It says it is in Jessamine County, but it's a Fayette County service. And then West Liberty and Whitesburg. So this is now there's a link here. So if you have this PowerPoint, you can click or you can take that and go quickly to that, but cdc.gov/news, NWSS. And this is the National Wastewater Surveillance System dashboard. This is from what date? July 12th. So I had to get this done early, but if you click now, and we can do this if in the question time if you want to see. But if you look at that, you can see influenza A, RSV, and COVID are all up on those are pages available, as is MPOX. That's not supposed to be such a concern for Kentucky, so we've been kind of left off of that surveillance. But you can see the color coding on here, and it will tell you what is going on as a snapshot across the country. So what we've done is in Kentucky, we've taken how news is presenting this information, and we have made our own dashboard. So this is a Kentucky wastewater surveillance system. It's on our health tracking web page within KDPH. If you click on that link, you can get to it. If you type it in, you should be able to find it online or to access. So these are our 5 emergency preparedness districts. They're used to working together on readiness and other issues. You can see we've got a couple in Western Kentucky, a couple down in the South, and we need to strengthen this. We have most of Louisville, Shelbyville, and you can see how it's divided. And then you can also see up here that we will show you it for local trends. So you can go specifically to your region, and you can also go into the region itself. So for everybody in the East, you can see what's going on. And you can do it for COVID, flu A, and RSV. This is an internal dashboard that we have available. You must ask permission to use it. It's much more complicated epidemiologically. One reason, and I'm going to go back here for a minute, the wastewater surveillance system uses a value that's called wastewater viral activity level, and that's WVAL. And it's really just kind of a metric that shows how much the activity has shifted from one week to the next. So it's a qualitative value that it's high relative to a baseline. They use that because wastewater data is actually measured in millions. And with numeracy being what it is, it's hard to comprehend what 2.7 million particles means versus 1 million. And it's too much for the general public. So because news uses this WVAL, that's exactly what we use on our public, just so we don't have conflicting values, and that things, this one you can easily get to, and it really gives you all the information you need to know. I'll click onto it when we finish the presentation, if that's helpful. Our internal one that our epidemiologists use within KDPH And some of our academic partners will show this. And these are the actual values. It will show you whether it was related to, and it has to do a lot with flow. So when there's a lot of rain, the concentrations might go down because it's diluted. If there's a mass event and the population data comes up, we can show that as well. So it kind of gives a little more input for people that have to make decisions on this. Now, this is the other one. This is wastewater scan. And wastewater scan is, they use a lab that is named Verily. And Verily is a subdivision of Alphabet, of Google. They are, CDC has made a national contract with Verily for some poor or states that are less organized, where we can get individual, they can just look for COVID, and I think they were looking for COVID and Mpox. Maybe they have the other respiratory viruses in there as well. This wastewater scan is a research project. It's directed by a faculty from the primary investigators are from Emory and from Stanford. And what they do is they're always kind of pushing out to see what is doable or what is reportable for a given situation. One thing we're looking at is picking a major site within each of our 5 regions and matching this profile for those sites. But that's something we're working on developing. So if you go to this website, Wastewater Scan, you will find they are looking for Morris Foreman, which is the only site in Kentucky being done. They also measure not only COVID and influenza and RSV, but they do human metapneumovirus, EBD68, norovirus, rotavirus, Candida auris, Hep A, both monkeypox, clades, parainfluenza, human adenovirus F, measles, and parvovirus. They can also do West Nile virus, and there's a couple of others. They can do it both from the liquid and the solid fraction. In this case, they do measles and wild type from the solid. So for whatever that's worth, that's also out there. If you go to the Q's dashboard on the health tracking site, you can get a direct link to wastewater scan from there. And we've been told that what they do is they average the data that we report from the liquid fraction for Morris Foreman and what is reported for the solid fraction. But I have not had that in writing from CDC yet. So what we know, what we do is that what we can see from, I can see this from this, from our site is that we really align a lot with the early predicted predictions of viral activity. So if we have a high site that's coming up, you will see high viral activity that comes 1 to 2 weeks later. And that pretty much is agreeable for all of the parameters so far that have been looked at. That just really gives you some early warning notice. We found U of L is a leader, a thought leader in wastewater surveillance, and particularly in just how it's received. They find that most people support, so they've done surveys. Most people surveyed support monitoring for diseases, environmental toxins, and terrorist threats. That covers quite a bit. It's at the most anonymous level. Most people prefer community-wide, which is what we're doing right now. Personal resident sampling would be less acceptable. One thing that we can do with this is if the local health department and the wastewater treatment plant are working together, that they can actually do specific site sampling at manholes covering certain neighborhoods or a given, hospital or nursing home, but that's something that has to be worked out at the local level. We don't do manhole sampling from the state level. So, and that's a nice paper there. So I just want to open this up for some questions, and it's a quick overview. I want to know, how can we help you? Does this give you any questions? Are there public health needs in your community that wastewater surveillance might support? What groups would benefit, and what do you think about this program, or questions?
We did get one question. How is it decided what will be monitored in wastewater?
So this began as um, a COVID surveillance. And it was very helpful in that, because it really was easier than contact tracing, right? Or easier than people. And as people go out and have test kits at home and everything else, they decided that we could move into respiratory viruses without causing it has to be publicly acceptable. It has to be something that the wastewater system will agree to do. And that means that the municipality is comfortable with. And so if you can think about the reception to things that happened around COVID did make a lot of people a little bit that's not the right word, a little hesitant to be part of surveillance. And so we've been working really hard to drive things the other way, and to show that this is awesome, because we, in all the funding cuts, we didn't receive any. This is a really great technology for looking at many things. One of the more controversial things that you can look at is illicit drugs. And that is a real hot potato. Fentanyl tracing, I mean, there are good uses to look for things like fentanyl or other, things happening in neighborhoods. But it's something that a municipality has to agree as a whole is important, is part of their value system, and something they would do. So we were limited at first getting this program, online and working really well to the 4 respiratory viruses. And at this point, we're talking about being able to expand, at least for our very largest cities, so that we can kind of match what other cities against what Louisville has. But we aren't there yet. This is, you have to have buy-in from local sites. And that's why we're talking to you a lot, because we think that you talk to your communities, and you are influential in your communities. So the wastewater treatment plant, oh yeah. I mean, I would love to help you work something like that out. If you want to contact me, yeah. On touring a wastewater treatment plant. We were just out at NACHO in Anaheim, and we got a fantastic tour of the Orange County wastewater treatment plant. And they have so many water problems. They get the water back to such an extent that they can inject it right back into the aquifer. It reduces their dependence on the river water and all that sort of stuff. It's a fantastic process, and it's filled with brilliant engineers that are always thinking of, how can we do this better? Yeah. And one thing, I'll give you an example. So my husband's a family physician, and he said, I'm starting to see a lot more respiratory complaints coming up. Do you think this is early flu? And I said, oh, you look at the dashboard. It's COVID again, and COVID is really starting to climb. And so what he does is he tells them to go get a home test, stay home, send somebody to the pharmacy to get it. And then once he knows what they have, he'll order a treatment, have somebody pick it up, and you reduce all that exposure. And it really, it's good for offices, physician offices, the physicians themselves. It's pretty good. Yeah, the illicit drug information is tough. But I'll tell you a really interesting. So we listened to a presentation from Laredo, Texas, and they had a huge problem with unintended fentanyl deaths, and the local health department actually initiated it with their wastewater treatment plant. So everybody's on board. They got the DEA involved. That has a one pill is one pill is not good or something like that is the thing, and the sheriff's department. And they went by manholes. Every time they had a hit on fentanyl, the local health department would go out on a door knocking and just talk to everybody. Where do you think this came from? Who was it? And it as a community, they worked to get rid of the dealers and to really target and help people in the area to be prepared. And it was wonderful, but it really takes a combined local effort. And that's why we reached out to Julia and infection the infection prevention group, just because you all can really help them manage it. In other ways, if law enforcement takes it on themselves, then it can be really problematic. One of the early stories is that with wastewater surveillance, so universities were using it, and it was used as a manhole outside of a dorm. And when they got a hit on COVID, they would go up and start testing all through the dorm. And then if they found the positive students, they'd put them into the quarantine dorm. And really, that's kind of an awful. I mean, if a freshman in college has enough anxiety to go on, they're just going to end up going to the library to go to the bathroom from then on, because they're so worried about who's tracking. So there's kind of a fine line. Some locations will do like elementary school. They'll specifically target schools and then give this report back. But that really has to be something the community is highly on board for, and not a suspicious problem to them.
So, Nancy, there's a couple of questions in the Q&A here as well. What is the threshold to determine if there is an outbreak versus if the community level is increasing?
Well, if it's something that we haven't seen before, that's one thing. We will typically tell you that it's increasing in your community. And outbreaks typically it'd be very hard for a large sewer shed. And you saw some of those numbers for, say, Lexington or Louisville, they're in tens of thousands. And so, we can tell you that it's increasing. For these pathogens that we're looking for, they aren't really the outbreak ones. There's next generation sequencing, which we're just considering right now, where you can look at, certain clades that are coming through. Or then there's also metagenomics, where they just sort of shotgun it. And that is something that there's a hybrid model where they're looking for a widespread panel of viruses. So say dengue or something else. And they're looking to do that as a pilot project for wastewater scans starting this fall. So I don't know if that's coming, and that's something we're keeping track of. We'd really like to see if we can get Morris Foreman to join that pilot program, just so that we're on the inside part of decisions made with these unexpected pathogens. But at this point with COVID and a flu outbreak, you'd have to be maybe looking at a specific elementary school and say, whoa, there it is. But if you're not on that level, you're just going to see increasing or decreasing trends, especially if we stay in the larger systems. Does that make sense?
Yes, absolutely. What are the expansion pathogens being considered?
Well, if you go back to that wastewater scan dashboard, those are those are pretty much accepted ones to look at. The CDC has told us not to, I mean, yeah. So within there, the idea that we can look for West Nile virus in populations is something that's also really kind of interesting. And we're really just in trying to develop the capacity to do that using certain labs. And then, but we have to really build the reception in municipalities. So you can see where we are right now. We really need some more sites, particularly in Western Kentucky and South, the South region. So getting communities of interest on board, say, we don't have Owensboro, we don't have Henderson, we don't have Paducah, we don't have E-Town, we don't have, look at it, you can see who's not on there. And so we have talked, and we talked earlier. And so most of my time in the last year has been spent building this foundation. We have an incredible team, a wastewater epidemiologist and our resource manager, our data manager that does all the uploading, and have developed these dashboards. We've got, the system is all down. And so we're on our way back out to sort of market it and changing it to this idea of centers of activity, that you are of such great economic and medical and vital importance to your region. Moorhead, for example, gosh, we really need you to be part of what we're doing, because it's going to help. It will help you, but it will help everybody around you. And since you're pulling in people, like Lexington has people from everywhere, it's really good to know this. And so we're getting ready to go back out and start working with the local entities again. And so part of my my selfish reason in asking to come on and talk about this is to try to pull the medical community into seeing the utility of this and where we could go with it. There's a lot in the literature. It's a great early warning system.
There's a question that's it says, I love that your husband is using this tool. Are there other physicians aware and using? And secondarily, is this tool being shared with news outlets for awareness?
We have not gotten to the news outlets yet. We have made this presentation. You are the first, and it was intended for ID doctors, nurse practitioners, and PAs, but there may be additional people on. I understand that Dr. Thurman does a presentation for all doctors. I've done it for residency groups and boards of health. It probably, there could be another, we just need more venues, and you were the start. So we're trying to move it forward. We feel we're in a good place. We're doing a lot of work with respiratory disease and making the dashboards talk to each other and say good things. They do have a green box on their page for us, but we think we can be utilized a lot more. So if you want to contact me, I'm the only Nancy Johnson at ky.gov. So nancy.johnson@ky.gov. And I'm happy to, if you have a board of health or anything, a local meeting, I'm happy to talk. I really think this is an incredible bipartisan surveillance tool that I don't see how it's awesome. Because we can see things early and we don't bother people. And we just help you get ready, and maybe we make a difference.
What have been the barriers to pulling in these regions? Is it more money, or are there other challenges?
I mean, we will give a payment for it. for a large system, it shouldn't be a problem because they're already taking samples from those composite samplers for other purposes. So it's just one more, and then FedEx comes and picks it up. There's just, there's a certain sense that there's a lot of, there's COVID fatigue. And somehow this has gotten completely, in some minds, it's still tied to that. That's why we've always focused on moving it to the respiratory dashboard, emphasizing the privacy piece and how much information we can get. There's, the idea that people can tell what's going on is something that, if you have strong privacy concerns, you want more information before you agree to it. And I don't know, and some people just can be ornery. I don't know. I don't want to do it. So we've taken a pause. I mean, we've got 21, which isn't bad. It's not, I mean, we're good and we have good coverage. We would like to make it better. And so we spent this past year just building everything that we can and making sure we have ways to, send out information and press releases and do all of that. And then go back out and intentionally say, we would like you to reconsider this again and relook at this and let me come talk to your Board of Health and share this with you on, and include the mayor, let's have a situation where I can share this with you and you can make an informed decision and not be working on old information. In the past, especially with there are things with the drugs that can be really just set people off, and they don't want to know. No one wants to know that there's drugs found in this neighborhood or that neighborhood, and good neighborhoods don't think it should be in theirs. Bad, you don't want to have a bad neighborhood or anything like that. And I think that's really skewed the conversation. That, and sometimes they look for things that maybe toxins that have been released. We have a very, defined portfolio of what we're looking for, defined parameters. And before we and this memorandum of agreement. So before we even change or expand, we have to get our sites to agree that that's something they want to do as well.
How do you combat skepticism when the dashboard for the respiratory dashboard, maybe for flu or COVID or RSV, might show different results than the wastewater surveillance dashboard?
See, and well, just I've had like 3 conversations on that internally in DPH recently. I have an awesome wastewater epidemiologist, and we are working on how to build that, because that's the thing, is that we will always, the disease data lags. We're a leading indicator. That's the lag. If we know that it's upcoming, and you'll see this in the next few weeks, but the problem is, if you look at it in real time, it's not going to agree. But one thing that I'm trying to even get them to move to is that there is the CDC actually has an outbreak potential dashboard. And I think it's inside of the presentation already. And we typically agree with that because CDC is integrating our data into their predictions. So.
Great conversation. Any other questions for Dr. Johnson or comments from the group? Give everybody just a second if they're feverishly typing. As always, this presentation has been recorded and will be placed onto our website, so you can reference back to it. I did put Dr. Johnson's email address into the chat, so
Would it help for me to go back to the public dashboard that everybody can get to right now and kind of go through that?
Yeah, that's a great idea.
And I would recommend, say, check it, Monday mornings and see what's cooking. So upload. Okay, so you will come to this page.
We still see your slide deck.
You do. Let me stop. So this is the link. And it's the quirk of the site. If you This is the information page, and it will explain to you what we do, and there's questions. So how does it work? It talks about the composite, which will help you. Talks about sentinel epidemiology, protection, how to use it, what else could be tested for. And then there's the actual dashboard. Oh, sorry, this is snow. That WVAL is a calculation that is made for each component. So right now, the statewide activity for COVID is currently high. If you scroll over, and that's for COVID, you can click for flu A. It's very low for flu A. RSV, I believe, is very low as well. And this is for the week ending September 6th. We'll be updating probably tomorrow, the internal one, and then it'll be updated again by Thursday if you check. So it's very low for RSV as well. You can look at the regional trends. And you can pick out what you want to have in there or not. So up here is the picker, right? If we take it off of all, if you want to look at central, which would be Louisville area, and then northern bluegrass, which is Lexington, let's say that for example. And then we have, you can see the comparison. In both, it's going up. Yellow is Louisville, brown is northern bluegrass. If we want to look at Bowling Green in addition, they're right, everybody. Well, no, we see a little drop over there. We'll see if that's a sustained drop or not. But regionally, you can see it for that whole region. And this would include like Somerset. It includes all the groups in that area. If we want to look specifically, so for example, if you want to know what's going on in Louisville specifically. So this is, you can see that these are the different, and we have got it. This diagram is the sewer shed. So in a given county, so for example, if you look at Fayette County, you can see that the Lexington sewer shed only covers part of Fayette County. And that is where it serves. Outside of that, there may be septic. So those are the kind of, that's really helpful. If we take this off and we want to look at Louisville, Morris Foreman, you can see a recent increase. We can look at all the ones we can look at the other locations too. I wonder if they can do both. And see if it's rising around there. So you can check and see what the different, and this one is a huge sewer shed. So you can see COVID for Louisville, Jessamine County, or Louisville. You have to read, it's a little.
While you're pulling that up, Dr. Johnson, there's one other question that came through.
Yeah.
Are there other states that have implemented this type of surveillance on a larger scale? And are they showing improvements in public health measures at an increased rate versus states without this sampling?
So, there are reports from every state in the country. Some states have less report, like Tennessee has less sites than we do. And recently their Bureau of Investigation decided they were going to use it for illicit substances, so that's an issue. But no, it is reported across the country. If you go to the national website, the news, cdc.gov/NWSS, you'll see a report from everyone there. Places like that, we have centers of excellence. You know, this has been it's a small, this has been a big ramp up since about 2022. There's like Wisconsin has been doing this for quite a while, and they're already showing sequencing. They have sequencing data and do a lot of really fantastic stuff. And it's incredibly useful in places like New York, California. Colorado uses it. Let's see, Houston as a major, mega city really uses it to a very great extent. So yes, no, that we have a lot of literature that says it so, and that's why we're able to keep building it within even Kentucky. That, I think this is a great technology. I think it's the privacy protections, the advance warning, just the cooperation so for example, we had a hit that was reported to us of H5N1 in one of the cities that we service. And I was able to get within an hour the health department, the wastewater treatment plant, and their academic partner all in a room. They kind of decided where they thought it was coming from. Working with the utility, they were able to go right to the manhole. They saw it. They figured it came from some kind of a packing plant or an animal incursion. They could see the animal. I mean, it came, it went, and it was gone. And it was such just a seamless way to look at a situation like that without making it into such a bigger deal. It could be handled and checked, and it was just wonderful. So yes, it's being used a lot. It's a lot in the literature. And it is a great technology. And I'm speaking to you all just because I'm really trying to build, a good wave of reception as we try to, bring in more locations into areas where we don't have as much representation. Does that make sense?
Absolutely, yes.
And this is the whole page on the WVAL in there. So it explains how we come up with all these calculations. And it's really, many researchers don't care for this. They say it's a little too blocky and hard to work with, and that's okay. It's really a communication point for the public and for, just providers. Just, it's higher, it's lower. That's all I want to know right now. An epidemiologist may want to fool around with the numbers a lot more, but this will at least give you a great snapshot. And it comports with everything used across the country.